I've made exactly 100 videos documenting my experience on semaglutide, the GLP-1 found in Ozempic and Wegovy. I've lost 40 pounds in 4 months while taking compound semaglutide in conjunction with a regimented fitness, nutrition, and supplementation program. So here's 4 months of work and hundreds of hours of research broken down into 37 simple takeaways to help you decide if GLP-1s are the right fit for you. First, you should probably know that there are 10 million users of GLP-1 medications worldwide, and there have been 51 known GLP-1 related deaths reported in the past 13 years. Meanwhile, there are 1 billion obese human beings on this planet, and there were 4.72 million obesity related deaths reported last year alone. For this reason, we should recognize that obesity is a disease, and anybody who says otherwise can kick rocks. We should also be upset that the statements "you're poor because you're fat" and "you're fat because you're poor" are both true and backed by science. Fat phobia is a thing. Let's do better. Ozempic face is not a thing. Seeing your jawline for the first time in 10 years, however, is. GLP-1s do not directly cause you to lose muscle mass or strength, but excessive calorie deficits do. What GLP-1s do is delay gastric emptying, and as a consequence, they make you feel more full for a longer amount of time and at a faster rate. GLP-1s also affect the release of dopamine, and for this reason, it is being studied for its potential benefits of other addictions, which is pretty cool, but it should also be known that GLP-1s have been shown to help and promote depressive-like symptoms and behaviors, so you gotta talk to your doctor before considering taking this medication. Yes, you can cycle on and off with GLP-1s. Yes, you can microdose GLP-1s. Ladies, I'm sorry to tell you this, but men typically respond quicker than you do to GLP-1s. And both a good or bad thing, you will have a higher rate of pregnancy while taking a GLP-1. The most common negative side effect you may experience is going to be nausea and constipation. A less common negative side effect that you might have seen is non-arteritic anterior ischemic optic neuropathy, which can lead to blindness. While it is rare, you need to speak to a doctor and find a reputable distributor of GLP-1s. Especially since, and I can't believe I'm saying this, counterfeit Ozempic exists, and it is a growing billion-dollar problem, which is stupid because there is no shortage of GLP-1s, only a manufactured shortage of brand name medication. And compound GLP-1s are just as effective as brand name GLP-1s, and while not available to purchase through your insurance, they cost a fraction of what the brand name stuff costs. If you order takeout twice a week, you can afford this once a month. I believe that there should be no shame around taking GLP-1s for either medical or cosmetic reasons. So if that's your hesitation, just go for it. And while the answer to weight loss is always a caloric deficit, the answer to a caloric deficit is not always just eat less. You should be as concerned about gaining the weight back after taking GLP-1s as you would be after trying a new diet. It might happen, it might not. So while you're on this medication, focus on building healthy habits around fitness, nutrition, and supplementation so you don't have to worry about it when you get off of it. GLP-1s won't do everything for you. You still gotta play the game to use the cheat codes. So let me help you play the game right. Realize that size is not the same thing as shape. Understand that in most cases, nutrition changes your size and fitness changes your shape. You need to get clear on which is more important to you right now. And if you want to do both, prioritize strength training over cardio. Prioritize protein intake over calorie counting. Prioritize hydration and sleep over good times and late nights. You are going to have to make some sacrifices. And take the right supplements. I recommend a pre-workout, creatine, protein, and a green supplement. Remember that the first step in weight loss is to stop seeing the scale move. The second step is to start seeing it move in the right direction. So be patient, and don't forget to celebrate every milestone. But if your gym is against GLP-1s or doesn't know how to help you while on your GLP-1 journey, it's probably time to find a new gym. If you have any questions, let me hear them in the comments. I'll see you later.